Bone density after 60. What actually builds it, and what doesn't? The silent shift. Bone loss does not announce itself. There is no daily signal that your skeleton is thinning, no soreness, no fatigue, no stiffness. Until one day, there's a fracture. After age 30, bone mass gradually declines. After 50, especially in women post-menopause, bone loss accelerates significantly. By 60, many adults are living with osteopenia. Some already meet criteria for osteoporosis. And fractures after 60 are not minor injuries. Hip fractures in older adults are associated with long-term mobility loss, increased dependency, higher one-year mortality rates. Bone is not passive structure. It is living tissue, and it responds or deteriorates based on stimulus. So today, we answer clearly. What actually builds bone density after 60? And what simply sounds helpful, but isn't enough? Part 1. Bone is dynamic, not static. Bone constantly remodels through two types of cells: osteoclasts, break down bone; osteoblasts, build new bone. In youth, formation exceeds breakdown. With aging, osteoclast activity increases. Osteoblast efficiency decreases. Hormonal shifts accelerate this imbalance. But here is the key. Bone adapts to mechanical strain. This is known as Wolff's Law. When bone experiences sufficient stress, it strengthens along lines of force. When it does not, it weakens. Bone is economical. It maintains only what is required. If demand decreases, density decreases. If demand increases, density can improve, even after 60. Part 2. The strain threshold. Bone requires a specific threshold of strain to stimulate adaptation. That threshold must exceed habitual load, be dynamic, be progressive. Low-level repetitive load, like casual walking, does not exceed that threshold in most adults. That's why long-term walkers often show maintenance of bone density, but not significant improvement. Research comparing walking to resistance training consistently shows resistance training produces greater improvements in hip and spinal bone mineral density. Bone is sensitive to magnitude and rate of force. Slow, predictable load equals minimal signal. Higher force, applied safely and progressively, equals adaptation. Part 3. Why walking maintains, but rarely builds. Walking is excellent for cardiovascular health. It improves circulation and mobility. But walking typically produces ground reaction forces around 1 to 1.5 times body weight. Resistance training can generate forces several times body weight through muscle contraction and joint compression. That difference matters. Bone cells, specifically osteocytes, detect mechanical strain through deformation of the bone matrix. If deformation is minimal, signaling is minimal. That's why habitual activity plateaus in effectiveness. To build, you must challenge. Part 4. Progressive resistance training and bone resistance. Training is the most consistently supported intervention for improving bone density in older adults. When muscles contract forcefully, they pull on tendon attachments. They create bending and compressive stress. They stimulate bone formation pathways. Meta-analyses show resistance training improves bone mineral density, particularly in the femoral neck, the lumbar spine, These are high-risk fracture areas. The most effective programs share characteristics: moderate to heavy load, multi-joint movements, progressive overload, 2 to 3 sessions per week. Light weights without progression are insufficient. Bone responds to mechanical demand, not repetition alone. Part 5. Impact loading, the missing variable. Bone responds not only to load magnitude, but also to load rate. Impact provides rapid force. Examples include stair climbing, step-ups, controlled hopping when appropriate, heel drops. High-impact activity has been shown to improve bone density more effectively than low-impact activity in some populations. However, impact must match individual capacity. For someone with severe osteoporosis, unsupervised jumping is not appropriate. But for someone with osteopenia, controlled impact can be beneficial. Avoiding all impact due to fear often accelerates decline. The body requires stimulus to remain strong. Part 6. Multi-directional force. Most daily movement is linear: forward walking, forward sitting, forward standing. Bone responds best when challenged in multiple directions. Unilateral exercises like lunges or single leg work stimulate lateral hip stability. Rotational stability challenges stimulate spinal resilience. Straight line living weakens structures designed for three-dimensional load. Bone thrives on variety. Part 7. Hormonal shifts after 60. Estrogen decline in women accelerates bone resorption. Estrogen regulates osteoclast activity. When estrogen decreases, bone breakdown increases. Bone formation cannot keep pace. In men, testosterone decline also contributes to bone loss. Mechanical loading does not replace hormones, but it does activate bone formation pathways independent of hormonal environment. Load partially offsets age-related decline. Inactivity accelerates it. Part 8. Nutrition. Necessary, but not sufficient. Calcium is required for bone mineralization. Vitamin D improves calcium absorption. Protein provides structural support for collagen matrix. But none of these independently build bone density without mechanical load. Think of nutrients as raw materials. Load is the architect. Protein intake after 60 should be adequate, often higher than commonly consumed. Low protein intake correlates with increased fracture risk. Bone and muscle are interconnected systems. Stronger muscle increases bone strain. Improved bone strain improves density. Part 9. What does not work alone? Let's clarify common misconceptions. Stretching does not build bone density. Light yoga without load does not significantly increase bone density. Casual walking is insufficient stimulus for improvement. Calcium alone does not reverse bone loss. These may support health, but they do not exceed strain threshold. bone requires challenge. Part 10. The minimum effective plan. For adults over 60 aiming to protect bone density, 2 to 3 resistance sessions weekly. Include
Squats or sit to stands, deadlift or hinge variations, step-ups or lunges, loaded carries. Load should feel challenging by final repetitions.
add stair climbing, incline walking, controlled low-level impact if appropriate. Bone adapts slowly. Meaningful changes often require months, not weeks. Consistency outperforms intensity spikes. Part 11. Fear versus capacity. Many adults reduce activity after a bone density diagnosis. This is understandable, but inactivity increases bone resorption. Capacity protects structure. The safest path is not avoidance. It is supervised strength, gradual progression, controlled challenge. Bone weakens without demand. It strengthens with it. Build the frame. Muscle moves you. Bone supports you. If muscle is the engine, bone is the frame. Walking maintains. Load builds. Nutrients support. Strain signals. After 60, bone density is not just about preventing fracture. It is about preserving structure for decades of movement. And in our next episode, we narrow the focus even further. Because weak legs don't just increase fall risk, they accelerate biological aging. We'll explore why lower body weakness ages you faster and exactly how to reverse it safely. Strength is systemic, and we're building it layer by layer. Until then, stay re-inspired.
I hope this video brought you value and re-inspired you. If so, please subscribe, hit like, and leave a comment. And if anybody you know could use a little re-inspiration, please send it to them. Thank you so much for watching.